my friends, welcome. This is Dr. Edgar Cologne. This is the People's CDC. That was Miguel Ackworth Ferguson Ensemble singing Donny Hathaway's classic, Someday We'll Be Free. And that's what we're all about here in the People's CDC. It's so good to be here in the webinar. Welcome to all the old comrades and the new comrades. And we're going to have a really interesting time today where we see the work we've been doing. And greetings, everyone. Say hi, especially new people. Put your greetings in there in the chat. Look at all these lovely people here. And I'm going to share just a little word of inspiration from one of my favorite queer poets and writers and playwrights and troublemakers, Tennessee Williams. And I think it's a great way to think about our work, but also it's LGBTQ plus Pride Month. So we want to also hold that out as something important to think about. Let me just try to do this real quick. I hope everyone can see it, right? And it's a very simple phrase, the world is violent and mercurial. We've seen that in the epidemic. It will have its way with you. We are saved only by love for each other, and the love that we pour into the art we feel compelled to share. Being a parent, being a writer, being a painter, being a friend. We live in a perpetually burning building, and what we must save from it all the time is love. And so that's the work we're about, and we're in the business of saving lives, and the building may be on fire, but we're going to save that love. And as you see all these people around you, what a magnificent host of comrades we have here. You see people who are about saving the love. So I'm going to turn it over to Faraz, and our speakers rows coming soon. So you get a sense of what's happening. Thank you, Faraz, who's doing incredible work just putting this. And this is our introductory webinar. And up next will be the origins of PCDC, our People's CDC with Mindy Fullove, and Faraz will be keeping our time. He is our time meister. Okay, go ahead, Dr. Fullove, please.
Thank you so much. So I'm talking about the origins of the People's CDC, and my name is Mindy Fullove, and I'm a professor I'm a professor at the New School, and I'm a social psychiatrist. And I've been working in public health for years and years. So the origins of the People's CDC, next slide, is really January 6th, Thursday, January 6th. Rob Wallace, who's here with us tonight, did a post on Spirit of 1848, and it was his piece analyzing what was going on in the government and what they were doing to manage the pandemic. And it was one of those things, as unflinching analysis that Rob Wallace is capable of, that really freaked me out and freaked a lot of people out. And it was also around the time when the CDC said, you don't need to quarantine for 10 days. You could just quarantine for 5 days if you're infected with COVID, which made me and others crazy. And so at that point, there was just a general sort of, oh my God, we have to do something. And so next slide. One of the people who wrote was Greg Gonsalves, who's a wonderful public health leader on faculty at Yale. And he said, so the question now is, what are we going to do about it? There are probably hundreds of people on this email list, if not thousands. Can we organize ourselves to do some political work together? And this just suddenly became, well, let's meet and talk about it. Next slide, please. And so I'm part of the Free People's University of Orange, which is one of the organizations that said, okay, we want to help. And we joined with the groups that you see here, the Pandemic Think Tank, the Pandemic Research for the People, Justice is Global, to sponsor a forum online called the CDC's COVID Collapse, Organizing for a People's Response. And so that was held on January 13th, Thursday, January 13th. And what was astounding was how many people came. So many people came. And all shared, I think we all shared a certain deep, profound, I don't even know what to call it, just like it was intolerable. It was intolerable that the CDC was giving people such bad information and that 1 million people were going to die. And that's perhaps what Rod Wallace said, which triggered the whole thing. He said 500,000 are dead, and there'll be another 500,000 dead in the spring. It was intolerable. That's not what public health is about. So hundreds of people signed up and came, and there were all different organizations and people from all over the country. And another group that had been organizing along similar lines, Mary Jamanis, Lucky Tran, and others who are here tonight, all joined with us. And so we all came together on that night, and out of that was born the idea of the People's CDC. Next slide. One of the first things we did was collectively write a mission statement, which you can see on our website. I just want to say it's very focused on COVID-19. And so it pretty much says what we think we are and what we think we're doing and what we invite you to join us in doing, which is to provide really sound information that's grounded in a deep analysis of the structural problems in the nation and in the world. And I would like to say I'm just was, somebody who loved and admired Shirley Chisholm, who was the first Black woman elected to Congress. She served 7 terms in Congress. And she was always, her slogan was unbought and unbossed. And that's what we are at the People's CDC. We're unbought and unbossed, and we want to tell the truth, and we want to talk about structure. Next slide. We learned from an industrial designer, Liam Van Vliet, that what you do to start is create a minimum viable product from which to learn. And I just want to say it was sort of, a collection of people with a lot of skills, but we hadn't worked before. We didn't know each other. We weren't one coherent organization. We were starting really from zero. And so this idea, okay, create a minimum viable product from which to learn, that was where we started. So we've been trying to do that since January 13th, or really January 20th. And so some of the things that we have created, I'll show you in the next slide. A group of people had already been working on this toolkit called Urgency of Equity, and that was the first thing that went up. And part of forming a new group is, and I am a social psychiatrist, so I love group process, but there is a process of forming, storming, norming, performing. You got to argue about how do you want to do things. And so we had a lot of arguments, like when would it be perfect? And that, of course, is always in tension with it's never going to be perfect, and let's just get started. That was a very important tension in our early days. But we did get the urgency of equity up on our urgency of equity toolkit up on our website. How exciting was that? And that was the minimum viable product from which we have been learning. The next really big thing we did, can you just go back? The next really big thing we did was that we wrote an op-ed, and we for the Guardian, and 2,000 people signed up to be part of us. We're like, wait, we have no idea what to do with 2,000 people, but we'll get there. And we also worked very hard to be able to have what we call COVID This Week and a weekly weather report, which are really our efforts to tell people to the best of our understanding what's going on. The other thing is that in our own meetings, we tried to create a loving atmosphere. We've been really fortunate to have the facilitation of Edgar Rivera Colon, and he's helped us to establish rituals. We have music to open and close, so moments of just caretaking. And while our goal is to take care of the whole world, I think it has been a great blessing to be able to gather once a week, do this work, and at least come to understand ourselves that we're doing the best we can to give decent public health information to the American people, to the world, the best we can. Next. And I'm a great admirer of Susan Levenstein, whose blog is called The Stethoscope on Rome. And on her blog, she talked about us. She said a site calling itself the People's CDC kept following the older valid measure of what was going on. And when the CDC had those new community level maps, and we said, no, that is not the right, those are lagging measures, and we need to have the best, most accurate measures. And so I thank Susan Levenstein for the shout out. And I hope that we continue to play that role. We are very pleased that we have gotten to the point where we have 14,000 followers on Twitter. We've just started our Instagram, but we already have 2,000 followers there. And we're growing and building, and there's a lot of work to do. And so we need, we hope that you will consider joining and doing this work. And let's see what we can do with this minimum viable product from which we can learn. What can we learn, and how can we do this even better? Thank you.
Hello, everybody. It's so wonderful to be here. I'm Rob Wallace. I'm an evolutionary epidemiologist with the People's CDC. And what I'm going to do in the next 10 minutes is actually give the COVID this week. And what we do with this COVID this week is internally, and also when we post it, is to kind of give us all ourselves a kind of crystallization of actually what's going on out there. We're very little guidance from the political class, both here and abroad. So we are on our own in terms of trying to figure out some of these things. I mean, we do use CDC data, we do use information from elsewhere, but kind of daily, or excuse me, weekly checking in about the state of the COVID pandemic is critical in terms of us making decisions about what we want to do in terms of pressuring various administrations to do the right thing. So this week, we're going to cover the state of global COVID, the state of US COVID, and two deadly risks that countries rolling back public health responses place millions of working people. So we have here in the red, we have the number of cases this week, and we see here an uptick in the last week. In the white are the number of deaths over the week, and we have a decline, less than 10,000, less than what was at the start of the pandemic in March 2020. And we have in the green a kind of the decline in terms of number of new shots that are being given to people worldwide. Next slide, please. This New York Times map shows hotspots over the past week in the Americas, Europe, Asia, and Australasia. There in the purple, we have Panama, Portugal, Taiwan, Australia, and New Zealand continue to be epicenters in average daily new cases per 100,000 population. This week, we have Chile, France, Germany, Greece, and Croatia returning to hotspot status. Over the past 2 weeks, Argentina, Italy, Great Britain, and Botswana also hosted increases in daily new cases. Next slide, please. Here's a 7-day average of daily confirmed COVID cases per million people from the beginning of the outbreak on the left all the way to today on the right. We can see the spikes in cases when Omicron emerged in late 2021. The present hotspots we noted in the previous map are trending in different directions. So we have Taiwan and Portugal outbreaks continue onward, both clocking in at about 30% in test positivity there in the brown. Australia and Finland appeared to continue to enter a decline in cases over months in epidemic cycles. A couple of weeks ago, we noted that Italy and Germany appeared to have their Omicron spikes under control, but this week we see those two countries, along with France, have re-entered their hotspot status. Next slide, please. Here we have COVID deaths per million people for these same countries over the course of the whole pandemic. And we see many of these countries suffered worse death loads early on, especially before vaccines were made available, at least to some parts of the world. We heard earlier that the global death load was in decline, but it depends where you are. We see here that deaths are up in Portugal and Australia, and were until recently spiking in Taiwan. So in other words, the pandemic continues, not only infecting people, but also killing people. Next slide, please. The virus also continues to evolve. So this is a family tree for COVID samples over the past 6 months, starting from the beginning of the pandemic at the center of the diagram and branching outward as SARS-2 evolves. And we see there in the dark blues and purples, the kind of early variants like alpha and beta, and the light blue are samples of the Delta variant. And we see over the past 6 months that Omicron subvariants, they're in yellow, but especially now in the oranges and reds, continue to explore SARS-2's evolutionary space. And across the Omicron group, we find molecular changes from the root of the SARS-2 tree here, numbering as high as 55 amino acid changes and 15 deletions. And all that means is that the virus continues to evolve along the way, experimenting with the human immune system to the tune of nearly 4 million new infections a week during what governments worldwide are treating as the end of the pandemic. Next slide, please. Turning to the US, this past week, COVID in the Northeast continues to decline in cases per 100,000 population. The upper Midwest appears also in COVID decline, but the rest of the country continues to host a rise in the floor of caseloads. So we have out in the West Coast, we have Appalachia, hosting widespread outbreaks. Counties along the Rockies, particularly Wyoming and in the Four Corners, are getting hit hard. Single counties across the plain states are kind of pinpricks of high infection. Florida's getting slammed, especially Miami, as are Alaska and Hawaii. Puerto Rico continues to host its months-long wide outbreak. Next slide, please. There are other ways of tracking COVID. The levels of SARS-2 virus detected in the wastewater that comes through our sewage plants, as reported May 31st to June 14th, here shows that the Pacific Northwest, the Bay Area, and Colorado are reporting the same high levels we saw on the caseload map there. SARS-2 is still high in Illinois wastewater, but like the caseload map appears beginning to decline, while in the Midwest and Northeast appears cooling off in those blues there. There are, at the same time, specific plants in the Northeast, here and there, that are detecting high caseloads. The empty circles represent plants that are only starting to take samples, but we see that much of the country still doesn't host sewage testing. Next slide, please. The changes in SARS-2 detected in these sewage plants over the past 15 days show some sites around the country in red, with increases in SARS-2 detected over 1,000% or more. So while the Northeast in the previous map appears to have cooled off, there remain spots that have shown sharp increases in the past couple of weeks, particularly in upstate New York. The Midwest and North Carolina, despite hosting Omicron outbreaks for months now, and having some areas in retraction, also appear to be hosting new surges here and there. Next slide, please. Now, the Omicron variant has an ill-earned reputation of being a relatively harmless infection. Hospitalizations requiring an ICU bed were indeed largely flat for most of the country this spring and into summer. But we also see continued upticks of 1% and 2% or more ICU beds filled in the past week, indicated here in the dark green and in blue. How much more than 2% increase, the CDC does not report. But we see new ICU increases in Nevada, Utah, Idaho, and Colorado. Compared to last week, we see such increases in different clusters of counties throughout the South and Midwest. We see declines in the Northeast, Ohio, and Michigan. Next slide, please. Now, a standing problem, however, is that the US appears to be willfully blinding itself to its own measures. In April, ABC News and other outlets reported the Department of Health and Human Services ended the requirement that hospitals report daily COVID deaths, overflow in ventilated COVID patients, and critical staffing shortages. Some US states outright ended reporting COVID metrics, hospital bed usage and availability, and ventilator use. Some states turned to delaying COVID-19 reports to reporting them on a weekly basis. Some hospitals followed the National Institute of Health's lead in changing definitions of COVID cases, including to only those patients that received antivirals remdesivir or dexamethasone. So your infection wouldn't count unless you needed those drugs. Next slide. So where are we overall as the CDC sees it? Here's the CDC's community level map, which, as we have discussed previous weeks, depends on the lagging indicator of hospital capacity. Hospitals only fill up weeks after an outbreak begins locally. Even when characterizing our pandemic in such optimistic terms, the US is increasingly moving out of a low level in green to medium and high exposure in yellows and oranges. And we saw that to be the case in the Midwest and Appalachia a couple of weeks ago, but now also see it in Pacific Northwest, the West Coast, the Four Corners, the Rockies, Florida, and Hawaii. Next slide. And the CDC has tucked away on its website another marker of the state of the US pandemic. The community transmission map, which is showing actual community transmission, shows for June 21st, all of the US save parts of New York State and the Great Plains in full transmission, with the Great Plains getting filled in by the week. So while the community level map, that was largely in green, shows 60% of US counties to be under low danger, this community transmission map shows 81% of US counties hosting high transmission. Next slide. Now, with such transmission, we see SARS-2, like on the global stage, evolving here in the US. We see here new variants first emerging and then dominating in cycles of every 2 months. So we have the BA2 Omicron variant in pink, was replaced by the BA12 subvariant in orange, which now being replaced by subvariants BA4 and 5 in green, which together presently account for nearly 35% of new cases. And the thing is, two dangers arise from letting SARS-2 run free this way. Next slide. The first is the virus may experiment enough to figure out how to emerge out of our vaccine's disease immunity, the protection the vaccines offer us from getting too sick when we're infected. This here is what's called an antigenic map. I'm not going to go into the details, but what it does is it tracks the antibody neutralization the vaccines provide in comparison to the circulating COVID variants. Other such maps have shown that the Omicron variant BA.1 evolved out from underneath the protection provided by being infected with early variants like Alpha and Beta and Delta. This map shows Omicron in pink has escaped the antibodies produced by the vaccines we've used to this point. That doesn't mean that the vaccines are useless, just that they don't necessarily produce Omicron-specific antibodies. Moderna is reporting its Omicron-specific vaccine to be successful, but we are likely in for boosters for years with no guarantee of SARS-2 on a 2-month schedule won't continue to evolve out from underneath their protection. Next slide. The second danger is the long COVID any one infection may induce, or perhaps the accumulative impact of multiple COVID infections causes. On the left, the little graphs in red show all the hazard ratios of all the body parts that have, all the body systems that have been documented to be impacted. The long in long COVID isn't just the length of time of such an infection, but also represents a foundational transition from an acute respiratory infection to a chronic condition of often devastating impact. And when we're talking various combinations of cognitive impairments, ulcers, pulmonary fibrosis, embolisms, diabetes, fatigue, and many other more illnesses in the list to the left of the human figure here. And to the right of the figure, we see all the different drugs long COVID patients are found to be at a higher risk of having to take. And that's why the People's CDC is adamant that all efforts must be made to implement a full array of public health interventions that keep all people susceptible and well from entering the horror of long COVID. Next slide. And that's COVID this week from the People's CDC. And you can learn more about the People's CDC and read this week's COVID weather report at peoplescdc.org. Thank you.
Thank you, Rob. That was amazing. And every week we do the COVID this week, also the weather report. And as Mindy said, we are an organization, but we are broken up into teams. So now each team member or each team is going to go on and kind of present something they're working on. And we're going to start off with Elaine.
Thank you, Faraz, for that, and thank you, Rob. So yeah, my name is Elaine Hills. I am an epidemiologist, and I'm here to talk about the public health communications team here at the People's CDC. Thank you all for joining us today. On the public health communications team, what we do is really try and hold true to the overall mission of the People's CDC. So what we do is create publications, and in doing so, we're providing guidance for the public and policy recommendations for governments and organizations on COVID-19. So we do this by disseminating really evidence-based updates, and we ground these in equity, public health principles, and the latest scientific literature. It's very much a team effort, and so who we are really ranges. We have team members that are health educators, epidemiologists, health communications specialists, community educators. There's a large group of people and a diversity of backgrounds. But we do welcome collaborators from throughout the People's CDC, and we include people from many different backgrounds, including people who are retirees, people who work at state health departments, people who are stay-at-home parents. So please join us, and we welcome all from the People's CDC to do so. Next slide, please. So the process that we go by in the public health communications team is very much a collaborative effort. It's particularly led by authors who are proposing the types of information that they want to publish about. They carry out the research and they develop that content and then carry the content through the publication process. But in doing that, they're also working with teams of reviewers. Reviewers are there to help review the content for the audience that we're aiming towards. Typically, we're aiming towards adolescents and adults in the US that are English speaking, and then we're working on getting translations in order as well. But we have some publications that might be geared towards professionals. So reviewers help with that, as well as fact checking and just ensuring that we have clarity in our messaging. And a big part of that is actually coming from the authors and reviewers also working in concert with our designers. The designers not only make our documents look really nice, but they are developing imagery that really helps improve content delivery, and they're formatting documents as well. All of our formatting for our info sheets so far, for instance, we're including accountability for having translations down the road. That's a process we're looking to build up. We're also ensuring that we have accessibility and readability accounted for throughout the way. So our products are meant to be accessible and readable to as wide of an audience as possible. Next slide, please. So this is an example of one of our documents that we've just recently published on our website. It's called our Layers of Protection document. The idea here is to give people strategies for how to reduce COVID-19 infection and spread, really recognizing that there are many different ways of living in the world and of living with COVID. And we're trying to give people choices and options for the best practices that they can implement to avoid COVID infection. In this, what we do is we direct people to through these purple arrows and purple boxes, we're directing people to other fact sheets that we have on each of the subjects of the type of layers that we recommend be implemented. Next slide, please. And we have more detailed fact sheets about several of these key protective layers. We're also directing people in the layers of protection document to think about where and when to apply these layers of protection. There's sort of this idea out there in the back to normal movement that if anybody is asked to wear a mask or have any mitigation strategy, that suddenly they're giving up all the freedoms in life. So what we're focusing on here is that you can live your life and have freedoms, and you can choose how to best implement this for you. Next slide, please. And this slide here is referring to some of the detailed fact sheets about those key layers of protection. So we have currently the mask up fact sheet. It's currently on our website, talking about high quality and well-fitting masks that you can use. We also have an airborne transmission fact sheet called How COVID Spreads. And we have an upcoming fact sheet on vaccinations and other topics as well. Next slide, please. So we have a number of different types of publications. I've shown you an example of our info sheets publications that we've been working on most recently. We also have coming out very soon some guidance documents around ventilation. These are really practical guides for how to implement ventilation to prevent transmission of COVID-19 in schools. There's another similar guide, it's very thorough, about COVID-19 transmission and ventilation issues in the workplace. We also publish articles. We've had articles about international vaccine disparities. And we've also recently had an article published about long COVID in kids, which long COVID is a subject that we definitely plan to be publishing more on and working with long COVID impacted community quite a bit on that. So we're looking forward to that important step. We have statements that we published. Oh, can you go back, please? Statements that we publish that include a statement about the CDC's change to COVID-19 guidelines back in February, and then our Guardian op-ed that was mentioned earlier. I also want to call your attention to the action tools that we're working on. So one that we've published is the template resolution on COVID-19. It's meant for you to go out and use and distribute in your communities to bring awareness, especially in public health and medical organizations, about COVID-19 prevention. Next slide, please. So huge amounts of gratitude to so many members and collaborators that helped with all of the documents we presented. We have members of the team who work on more of the stages and documents of this process. And then we also have many, many collaborators from throughout the People's CDC who work with our team to create these products. It's really a team effort. Next slide, please. And of course, we welcome all new members. Please contact us to join. pcdc.publichealthcoms@gmail.com is our team's email address, and we really hope you'll join us. Thank you.
Hi, everybody. Can people hear me? I guess I have no feedback. I'm Zoe. You might also hear from my baby Maya, who is currently nursing / biting my nipple. I'm going to present on the Urgency of Equity Toolkit, which Mindy referenced earlier. Basically, this toolkit was one of the first products that we sort of came together with in the initial sort of evolution of the People's CDC. But there were a lot of other groups involved, including the Vax Plus Coalition and some long COVID groups, and just individuals that had been loosely sort of organized or affiliated with each other in like Twitter DM groups or whatever. So we basically created, and this was sort of in response to the urgency of normal toolkit, a toolkit for parents and students, teachers, other folks who intersect with the schools in our country, to provide them evidence about mitigation efforts. So the process was basically drafting, then we sought feedback from outside experts and tried to incorporate it. And then we reviewed the content with people who were impacted and other experts, and tried to get some signatories on board. And then we released it. We've been working since on trying to update it. We're calling this a version 1.1 because we have very specific sections that we're trying to update. But I think we're thinking of like a full revamp to even maybe the structure of the toolkit, and thinking more about accessibility and or, you know, other toolkits. But all of these things have been just on the back burner because they're not, there's just only so much time in the day and so many people involved. So we would love to have you involved in helping us create the next toolkit, whether it's, you know, version 2 for schools or other toolkits going forward. And then the weather report is another one of the first types of publications that we put together, and that now we have a process where we're able to sort of churn it out weekly. You might have seen this on Twitter. But basically, it's just a weekly update, an overview of what's going on in COVID transmission. Like Mindy said, we lead with that map. And we also just try and give folks a broad overview of like what's going on in research, news, policy, all related to COVID. We post it on Twitter and to our website, and then we hand it off to the video team, who I think is going to present next, so that they can produce some snippets for social media videos. In general, our timeline or process is we do use the CDC data, so they update that on Wednesdays. So, you know, earlier in the week, we kind of, you know, anybody who sees any important news can sort of drop little notes in the working Google document. But really, we export a lot of the data from the CDC website and other of our data on like Thursday and Friday and start writing it. And then we have folks fact check and edit over the weekends with the aim to post on Mondays. And then, like I said, we pass it to the video team. Can we have the next slide? So basically, you know, in my ideal version of the weather report is we get enough people involved and engaged that we could have like maybe 4 or 5 teams that can each do a weather report once a week. This is like, the dream. So we really would love to have people engaged in the weather report. And the things that need done are, you know, we need people to help draft it, can pull the data and kind of contextualize it. People who can help us fact check. And then for each of our images, we create alt text. So we need people to do that. And we would love to put the weather report out in other languages. So we would love to have translators involved. If you're already in the People CDC and want to get engaged or involved in the weather report, we have a Slack channel, so find us there. Pinned at the top of the Slack channel, we have a weather report folder, and in that folder is like an orientation video. And also there's an Excel spreadsheet where Caroline has created a way to sign up for, you know, each of the jobs that need to be done. You can also DM me, Maria, or Caroline. If you're not looped into the People CDC on Slack, just email the People CDC. I think there's going to be a contact link at the end of this webinar. So just let them know that you want to join us, and they'll put you in touch. Thanks so much.
Hi, I'm up next. Thank you, Zoe, and everyone who's come before me. Well, I will cede, first of all, a couple of minutes of my time to the video itself, which you guys are about to see. If you could please play that. This is the weather report video from this week.
The U.S. is in a sustained surge with nearly the entire country at high or substantial transmission levels. Welcome to the weather report from the People CDC for the week of June 21st, 2022. This week, the CDC's transmission map shows 99% of people living in areas with high or substantial transmission. While the BA.212 variant has reached its peak in many areas, BA.4 and 5 have arrived and are now causing 22% of cases nationwide and making up a higher proportion of cases in the West and Midwest. Nationally, wastewater levels are plateauing at about the same level as last year's Delta surge. And for 8 weeks in a row, hospitalizations are rising. In vaccine news, the FDA approved both Moderna and Pfizer vaccines for children 6 months to 5 years old, and while these vaccines are still designed for the original strain, they are nevertheless important tools that children deserve access to. Past infections with Omicron does not boost against later variants. At the People CDC, we are concerned that case levels may remain high throughout the summer, given the continued emergence of new variants and potential for reinfection. Different layers of protection like vaccines and boosters, high-quality masks, improved ventilation, access to testing are all critical at preventing these ongoing transmissions. We also need updated vaccines and paid sick leave for all. New research suggests that leading theories behind what is causing long COVID, microscopic clots, lingering virus, or an overreactive immune system. In addition, researchers report that brain fog, a common symptom of long COVID, may be related to brain plaques like those seen in Alzheimer's. More research like this is needed in order to understand, prevent, and find treatments for this complicated condition. Join us as we demand a comprehensive response to the pandemic that keeps all of us healthy and safe and puts our most vulnerable first. That's it for this week's weather report from the People CDC.
So that, as you see, is our weather report video that we produce weekly. Again, as the weather report team turns around the written, that does the research, fact checks, and then we take it over, then post it, then we take it over, we turn it into a script, we record it, we edit it, and we post it on multiple platforms. To answer actually the question that's been posed in the chat, we are absolutely creating these videos, and in fact, all of the things that we're doing with the intention of reaching out, not just across social media, but in fact, as popular education tools that can be used by community organizations. And I would just sort of reiterate and say that we very much see our role as translating the science, the actual science, not the CDC's misinformation, into accessible information for different kinds of people to use. Of course, there's not quite enough of us to be able to get this information and get these kind of videos out there as we would like, which is why we need you to come in and join us. Things that we need, certainly more video editors, motion graphics people, graphic designers, script writers, presenters. As you see, you can just write to the People CDC email list and attention video team in the chat, and we are working on more explainer videos. We have one that's coming out in the next couple of days about the CDC maps. And actually, could you go to the next slide, Firas? Thank you very much. And sort of in tandem with the weather report team and the urgency of equity toolkit, we're also putting out, again, sort of like smaller kinds of publications that are coming out through initially through social media, but once again, with the intention of getting out to community organizations and to as many people as possible, because that's really where we see this gap, all of us. And so this is one that we've made. It's a series of slides on testing, the difference between PCR and rapid antigen tests. And we will be having another one coming out next week, I think, the part 2 of these slides. But essentially our process, once again, is like the urgency of equity toolkit. We do a lot of research, then we sort of tag in some self-described experts, people who really know the literature really well, because we want to make sure that we're not just citing, the CDC, but in fact, we're also citing primary literature, because things are changing so much, especially around testing with the new variants, for example. And so then we put it together, we design it, and we put it out there. And so these, as you've sort of seen, there is a lot of overlap between what the different kinds of teams are doing. We would love your help. And yes, please contact us to get involved. Again, info@peoplecdc.org, attention video team. And thank you everyone once again.
Hi everyone, welcome to the People CDC. So excited seeing so many new people here. My name's Lucky and I am on the media and design team. So what is the media and design team? Really, I guess the top line is we're an infrastructure team. So you've been hearing about all these wonderful, wonderful projects which are building important information and content to get out to communities and people everywhere on the pandemic. And really the goal of the media team and design team is to figure out and help all of our project teams and working groups connect with people all around the country, community groups all around the country, journalists, figure out how to get that information out to as many places as is needed as we need right now. So I guess in terms of, it's also worth talking a little bit about the broad strategy, which you've heard a bit at the intro and through the different project teams. And I think framing it in terms of two goals is really that what do you do when the government abandons you to mass infection, mass disability, and mass death? And really, I think the People CDC has two main responses. One is mutual aid, right? Is how do we get information out to our communities, to the people, in order to protect ourselves from this complete abandonment of public health. So that's mutual aid, and you've seen how all the teams are producing wonderful information that we can sort of help get out to our communities. The other thing is that we still need to pressure, the people who are in power, who are in charge. We can't forget that completely, right? Because they have a lot of power and resources, and we just can't let the situation go on. And so one of the levers for that is really the narrative that goes on in the media. So what's the current administration and really the entrenched powers are really good at making sure that their talking heads on CNN, their op-eds in the New York Times, they all are coordinated on the narrative of just letting it rip. And so the People CDC has really inspired me, and all the people in our teams have really inspired me, because we really are sort of thinking that there is an alternative, there is a more equitable, just way we can manage a pandemic. And so that's what we're working on. Next slide, please. And so, yeah, here's a summary of some of the tangible work that we are doing. So as mentioned, we're part of that process of narrative change is building relationships with the press and figuring out where to pitch stories and, helping place op-eds like the one we had before. Figuring out rapid response statements. So when the CDC or White House makes a problematic guideline or policy or statement, can we push back against that? What would that look like? Increasing our social media presence. That's a powerful way to distribute information. Improving website accessibility and user experience, and establishing branding and language standards. So this wonderful logo here in sort of our purple orange design colors was actually designed by a group called Design Action Collective, which is a grassroots group which does design for social movements. And we have many wonderful in-house designers and web people as well. And so there's a lot of wonderful work building out that identity. And lastly, sort of working with groups like the community team to figure out other distributions. So it's not just about the media, as mentioned before, it's about how do we get that mutual aid out with communities, and how do we have communities informing our process and our content as well. So building relationships with community and advocacy organizations. Next slide, please. And yeah, finally, I would like to say, who can join? And this goes with all of the People CDC's teams, but it's worth mentioning again, is that the People CDC is really everyone. I think it's an important thing to mention, because sometimes, like, as you say, in the mainstream response to the pandemic, there is sometimes gatekeeping between people who are powerful and people who maybe have sort of academic privilege and things like that. But it's important that, our response is centered in the people, right? And that includes everyone, particularly communities who are most impacted, like communities of color, people who are immunocompromised, people who are most vulnerable, essential workers, etc. So that's really important part of I guess, joining in and participating in all our teams and how we work together. And so we're as Mindy said before, we're figuring out how to work together, but that's an important principle for all of us. And so for the media and design team, of course, we'd love people with, comms, media, PR, design experience, but that's not a requirement at all. And it's absolutely not a requirement to, be an academic or public health expert. That's really important. In fact, it's sort of a strength to have many other people because there's so many things that go into policy. Especially lived experience is really important. And so, we on the media and design team and all of our People CDC teams really welcome everyone. And we will run, a lot of this stuff for me. My background is actually as a research scientist, researching microbes. But my day job now is in communications, and I just learned off other people how to do that. So I know for a lot of the work that we do on the media and design team, you can learn that. And sort of part of the way we work is we want to run skill shares and we want to help people. Anyone who wants to participate, we want to help get up to speed because there's nothing super special about the skills required to do this work. And I think we really want to build each other up and sort of help ourselves or develop the skills that's needed in this critical time. So yeah, please join. To join, you can email media@peoplecdc.org or join the media team on Slack. And at the end of this, we'll also share a form with all the different lists of the different teams that you can sign up to that form to join all of our teams. So yeah, thank you, everyone.
Hi, folks. I'm Linda Green. I'm a community communist activist, a retired physician, and the community group that works with the People CDC has had a variety of people come through it during the last few months, but we really could use some consistency in our group. But we have had people from Houston, New Jersey, New York, Baltimore, and the area right outside DC where I am from, and Seattle. And we could welcome anyone who wants to do grassroots outreach. Workplace communities really are part of our community. Someone else will speak in a minute on other aspects of community outreach, but I wanted to talk about our work with labor first, because I think if we're going to build a movement that's going to have power, we have to have workers and students involved in building a real movement that's anti-racist, multiracial, and that really understands some of these issues well enough to feel that they can fight back on them. So I've been very encouraged by working with transit workers in the Washington, DC area, where there's been like a strike of the circulator workers who drive tourists all around Washington, DC. And in meeting with them, for example, they felt that they didn't get masks, that they thought that the agency should provide them with safe masks and things like that, which had never really considered, we had never really considered that that should be a demand. They need safe equipment in transit and ventilation for buses, trains, at the stations of the subway and other stations for other types of transportation, like Union Station, and to fight back for masks, free fares, and rear door entry. At the beginning of the pandemic, the metro system in Washington did have no fares. People entered through the buses through the back, and everyone was masked. Now, none of that is actually active right now. And I just met with a safety officer from the union, ATU 689, and he has a book like this of safety things that he's been working on for 2 years. So we're really missing the boat if we don't reach out to some of these union folks who really understand their workplace. The second area is colleges and campuses. The colleges need these COVID safe campuses. There's some groups working on this. At the University of Maryland, there been some fight back around having access to being able to work from home for both workers and students, to have better transportation systems for them. And one of the groups, which you might not have thought of, the United Students Against Sweatshops, said, yeah, we're going to fight around that too. We're going to add that to our agenda. So we need to reach the campus groups. We need to reach the colleges. And finally, the teachers unions are taking advantage of the urgency of equity document that was described earlier. And we've raised it with the Prince George's County Union, a teachers union that's currently negotiating its contract. And well, they have a lot of demands in their contract, but hopefully some of this will push through and will continue to improve the safety in the schools. And I wanted to make one more comment about the schools, because for the first time in maybe 50 years, the U.S. Education Department is planning to update federal mandates for how schools and colleges accommodate students with disabilities. The department is soliciting public comments, and this is to improve, in section 504 of the Rehabilitation Act of 1973. So it can be updated and we really would like people to participate in thinking about how we can send in some suggestions around all these other issues that we've talked about: ventilation, masking, distancing, isolation, and testing. So thank you very much, and we'll go on to the other half of the community presentation.
Thank you so much, Linda. Good evening, everyone. And thanks to everyone who's presented before me. I am Molly Kaufman. I'm co-director of the University of Orange, which is based in Orange, New Jersey. We're a free school and a people's university. And first, I just want to say how heartening it is to be here with all of you this evening. I'm just going to talk a little bit about this little booklet we made. So last spring, I believe, some colleagues that we work with, including colleagues who are part of a community group called The Hub and the Healthy Orange Coalition, which is a local grassroots health coalition, were able to receive some resources to do a vaccination campaign. At that time, our rates of people being vaccinated in Orange were pretty low. And so we felt really strongly that if we could work with a street team and community healthcare workers to do outreach to people, like really face-to-face in terms of outreaching people to get vaccinated, that would be really a helpful thing to do. But by the time we were able to hire this team and we had resources, and actually many more people in our community were vaccinated, and through working with the People's CDC, we realized that the other area we really needed to address was making sure that people had access to relevant, up-to-date information, and that people were being informed, that we are still in this pandemic. And so we worked with members of our street team and other members of our community who have been coming to People's CDC meetings, and we took all of this great information that our colleagues have been putting out there and really focused in on this idea of making sure we could share with people about the layers of protection. What are all the things we can be doing to keep safe? And we made this little booklet, Community Care During the COVID-19 Pandemic. It's also a coloring book. We have little oranges and masks because we're orange. Also, the people who were really interacting with having conversations with people every day about vaccinations also really pointed out that people had questions about where they could access resources. So the end of our book has information about local resources in terms of if people need rental assistance, food access, healthcare, all kinds of, also information about like outdoor gathering spaces, like all kinds of local stuff. So this has been, we were just really grateful that we were able to work with People's CDC. And now that we sort of have something that can be really like handed to people so that people can be getting it from somebody that they trust and know, so that they're able to access relevant, timely public health information from a trusted source. And this will be available on our website with the text and the images we currently have it translated into Spanish. We will have it translated into Haitian Creole because that's kind of the main languages in Orange. All of that will be available on the People's CDC website if people want to customize it for your use in where you are. And then you can add kind of your local resources. And yeah, we made it black and white so that it's affordable for people to print out. And I guess just the final thing I wanted to say is that we're all super grateful to all of our colleagues at the People's CDC, and that we've taken the time to be a part of it, because it's really helped guide our decision making all through the winter and the spring in terms of, we were planning a big music festival. Are we going to have this community potluck? Just how to be super thoughtful and conscientious as we're aiming to bring people together and provide resources for people as we're doing our work. We're extremely grateful to be part of the People's CDC. And so hopefully come join the community group. Thank you so much, everybody.
Hi, everyone. Thank you so much for all of the people who presented before me, and for all of the wonderful folks who are joining us today. I'm going to talk a little bit about the People's External Review of the CDC, first by just kind of presenting to all of you our theory of change, which is essentially, and I'll just say a word about myself. I am a primary care physician, and I also am a public health researcher based in Massachusetts, and I'm also a community organizer and have been working with the Massachusetts Coalition for Health Equity, pushing for COVID-related protections and other equity-based issues in Massachusetts. And so we have been working on a People's External Review of the CDC in keeping with this concept of ourselves as attempting to be a shadow CDC, essentially being the CDC that we all wish the CDC would be, and kind of trying to present that as a way, or as kind of an exemplar that we hope ultimately the CDC will follow, and kind of calling them in. And so we have therefore launched a People's Review of the CDC in response to the formal review of the CDC that Director Rochelle Walensky requested in April 2022. Next slide, please. So this, our working group it's a really a rather a relatively short-lived project, unlike many of the more kind of structural working groups that will continue to exist. But we aim to be sharing a survey. So essentially, our process of development was that an interdisciplinary group of People CDC members, including academics, individuals impacted by COVID, disability rights activists, health workers, and people with various academic backgrounds, developed 7 to 10 overarching objectives, which we imagined would exemplify an ideal pandemic response. I don't want to give away all the elements that will be in the report card, but you can see them yourself because we developed them into a survey. But essentially, there are things like equity, scientific integrity, inclusivity, addressing root causes, etc. And we converted the objectives into a brief survey, which we will be administering via Google Forms. We disseminated it to People CDC membership, health workers, and public health practitioners and researchers, and local and national organizations disproportionately impacted by COVID. I'm actually just going to enter this. I think I just sent it to the host and panelists, so I'm going to send it to everyone. But basically, we would love for you to take a look at the survey and share it with your communities, fill it out yourselves, and share it with folks who are impacted by COVID. We would love to increase the number of responses that we have. Right now, we're at around 170. We have a little bit of sample language if you want to share it. Could you please switch to the next slide? We will be presenting the results of the survey in the form of a report card at a press conference and webinar, which will be live streamed to the public in mid-July. We may have an accompanying press strategy trying to identify a reporter that would be interested in doing in-depth coverage before that comes out. I had said mid-July, but I think it's actually going to be a little bit later than that. And we might even consider a future publication based on our survey results, like for an academic journal. And so we're just asking everyone here in attendance to please take and share our survey with individuals and organizations impacted by COVID. Take it yourselves, share it with others. We have a little bit of suggested email text here, and really looking forward to seeing and sharing the results. Thank you.
Hi, I'm Sam Friedman. I spent about 40 years studying HIV, and I'm now also working on overdose. And I've been an activist on all those things and a revolutionary socialist activist. When the COVID epidemic hit, I realized I couldn't keep up with the science at my age. So instead, I'm trying to do work with the community group and with the art group, because I've done a lot of poetry that's been useful in the AIDS field and in the socialist field. The arts group is a collection of creative artists who work in very different media, as I'll talk in a minute. We have skills in poetry, graphic design, music, embroidery, zines, collage, and so forth. And a lot of us as individuals work with some of the other work groups and teams. But we meet once a week, currently Saturday afternoons, to discuss our individual art and collective art projects that are consistent with PCDC goals and interests and visions. And as we do it, our various ideas about art really spark each other. For example, Hope got the idea of an embroidery where she's going to have on a top level the green fake CDC map, which makes everyone go to sleep and say there's no problem. And underneath it, the essence of the reality, which is the red map. And as we've talked about it, it sparked various people to do collages and poetry and so forth. I've written several out of that. And I'm going to close with a poem which came out of that process called We Who Remember. First, I'm going to drink. We who remember how presidents spat bile on junkies and fags, said never, ever, never as they banned syringe exchange and hid smiles of glee behind crocodile tears as AIDS deaths soared like the stocks of Dow Jones and Big Pharma. We who remember, we who cried, while the rich got richer as nurses used and reused homemade masks that leaked during imputations. We who watched Big Pharma grow fat from selling vaccines only to countries of the rich, as with ART for years, even decades, as the viruses decimated the poor, like the Roman legions, the Nazis, or GIs in lands they conquered. We who remember, we who cry, watch the ways of the powerful, watch the wiles of the rich while they use us, use you, lower our pay, deny coverage and sick leave, they who prosper, while I, you, we sicken, while I, you, we die. We who remember, we who cried then as we cry now, knew no surprise at the millions they let die. We who remember, we who cry, have learned what to hate. And we use our years and hours thinking, pondering, who are we? Who are they? How our we might ever unite to tear down their edifice of power, their edifice of hate. And we who remember will never forgive and never forget. Thank you.
Thank you very much, Dr. Sam Friedman, someone who's been in struggle for years, someone who's been faithful to the struggle, who's fought the good fight. And thank you for the arts, comrades, because really it's all struggles need art. All struggles need art. It's one of our weapons, the cultural weapon. And thank you for all the people who have presented today. What an incredible group of folks we've been lucky enough to run into because of history. And if you want to get involved, I'll let Faraz do this piece of it because he's got this tech thing going on there. He's bringing us to a higher level of digital literacy. Go ahead, Faraz.
Thank you, maybe put me on the spot here. So yeah, if you want to get involved, guys, you can follow us on social medias. We're on Twitter, TikTok, Instagram, also YouTube. Got to put on here at People CDC. Give us a follow there. You can contact us at info@peoplecdc.org. Just put a tagline if you saw a team name that kind of popped out at you want to get involved with. But honestly, the best way to get involved with us is this QR code in the corner. If you scan that code, it'll take you to a Google form. It'll ask you basic information, name, some demographic information, also what team you want to get involved in. All the team names will be listed there. Any special skills you have. And then we'll work on getting you in touch and contact with the right teams, whether that's with their emails or through Slack. But yeah, fill out the form if you want to get involved. Truly any help really helps in this situation. As you can see, these are amazing people that we have on the team. And if you're here, I'm sure you're also an amazing person. So come on, join the cause.
Thank you so much, Faraz. I just want to say Faraz is one of the most amazing of us, this amazing host of people. So he's very self-effacing, but he does a lot of work, and he's joined us and brought so much organization and joy into our work. So thank you, brother. Thank you always. And now I think we have some time for Q&A. Usually the way our meetings run is we just go to the last minute because we have so much work and reporting to do. So maybe we'll keep this up for folks to put the scan on, but maybe we can do some question and answers if people, and of course, panelists, feel free to recruit for your team. And also I noticed that Lucky put in a Google Doc also. And obviously all the teams have needs for new members, for new ideas. And I just want to underline something that Lucky said, which is you don't have to be an expert. You just have to be here and in this struggle, right? Because this is the People's CDC. This is not the CDC. And also in terms of our structure, Rob Wallace has talked a lot about our wave and trolley sort of format, but that you come, you do your work, you may have to get off the trolley for a little bit, but you come back and we do this together. We're learning how to work together step by step. And that thing that Mindy sort of taught us, minimal viral prep from which we can learn, and we are still learning and open to learning. And that's an important thing. So are there questions and answers for us to do now?
So the first one comes from Yanis. I'm sorry if I butchered that name. She said, what's the end goal of People's CDC? I joined late. Could you please reiterate? Okay, so what is the end goal of People's CDC? Who would like to take that question on? I could respond, but I'm a facilitator and I take too much time, airtime as it is. So who would like to respond? What is the end game? That's a great question to ask. Thank you, Yanis. I'm a teacher, so I'll just pick somebody up. About 2 seconds. Let's hear from Mindy full of love, and then let's go around if people want to respond. What is the end goal?
Hi, Edgar. I think that, we have to think short-term, mid-term, and long-term. And the short-term is really to push for changing the narrative around the fact that we're not in a pandemic that's over, we're in a pandemic that's ongoing. And the potential for the virus to keep evolving and keep killing people and come back strong with a new variant is very real. And plus, there's all kinds of other pathogens out there that can be coming at us. So how do we, short term, how do we change the narrative around this pandemic? Mid-term, how do we really raise awareness? And then long term, we're really in a real crisis of sustainability for the whole world. So how do we get to a more sustainable way of living on this planet? And for us, maybe you could just stop the screen share and the whole panel could come back on.
Thank you so much.
And you could even unpin Edgar and we could all just be here. How about that? Thanks.
Yeah, so I think the next question is Michael has his hand up. So Michael, go ahead.
All right, can you hear me?
Yeah.
Yep.
All right, I just wondered if the panel could respond specifically about or specifically regarding if it has any plans to try to further publicize some of the data that I'm sure you're aware, some of the research that's come out of the University of Tokyo regarding BA4 and 5 potentially causing more severe disease, reverting back to causing lower respiratory tract infection. because that's one of the things that has me most worried right now, and that potentially in the fall, we're going to have a really disastrous fall with this more, I guess you'd call it pathogenic form of Omicron. So I was just curious as to what might be being done regarding that. Thank you.
Thank you, Michael, for that question. Does anybody want to take that up?
I'll just quickly say that, we haven't got into that research, but, this is an opportunity to write this up. So there are means and mechanisms by which any new topic that comes up that is of concern, we can gather a team together to write something up on that direction. And as Mindy talked about, clearly the notion of new variants is very much front and center in terms of People CDC's understanding of the danger that we're still in. So that is where we are with that. We could write this up if it's as a group, and if someone finds that of importance to write it up, we can put together a team to write up the dispatch and do so.
Great, thank you for that. And thank you for that question. Next question for us.
Yeah, so next question I think comes from Kathy Powers. Go ahead.
Oh, I just have an end goal. I don't have a question. And I think eventually the real end goal is to rebuild the public health system. That is our end goal. This is just one thing. And I always think to myself, God, how do we call out the CDC? Everybody believes them. And that, there's no real information out there. So, I do what I can. I work with the People's Response Network in Chicago. And, I'm delighted to be here. And I really want to hear some good ideas. And some bad ideas too. Why not?
Great, Kathy, thank you for that. Yeah, I think that's one of the things we're constantly thinking about. What would an actually good public health response be? Sam Friedman may have an idea about that.
Yeah. One of the nice things about PCDC is we disagree with each other a lot and do it in a friendly, loving way. I agree that's an end goal, but it's kind of a middle level in end goal for me. I think that the same capitalist world system that is bringing us pandemic after pandemic, that is basically letting people die, is also bringing us climate change, is bringing us constant threats of war and real wars, makes life boring or overworked or miserable for most of the people on the globe. I could go on and on and on. And my end goal is to get rid of all that and to build something where we can love each other and sustain the planet.
Thank you, Sam, for that. And I would recommend that people look at some of the work that Kali Akuno has been doing in cooperation in Jackson, Mississippi. There's an interview he just did called Eco-Socialism or Death. And I think that he's sort of right on target there, that it used to be the old thing, socialism or barbarism, right? But it really is eco-socialism. We need to have some kind of different system. But thank you for that, Sam. And thank you for that question. What a lovely question. Other folks want to chime in? I saw some heads going like this. Well, not exactly like that. Anybody else? Okay. So yeah, end capitalism. I'm down with that, sister. Okay. Faraz, go ahead.
Next question comes from Alex Medeiros. They're curious about the underlying legal structure of the organization. It says zero judgment either way. Is it a nonprofit, fully volunteer-based? Kind of a little more about that.
Do we have a legal structure? Who wants to respond to that one? I mean, we're a coalition. So we have people who are individuals and people who are part of orgs, and their orgs may have probably not-for-profit status. But as a People CDC, I don't know if we have that kind of structure or whether we're going to go there. Anybody else want to respond to that? because I don't think I'm covering it necessarily.
Yeah, I agree with Sam. We're all volunteer and we get, we just do stuff without really needing to think about funding streams or, being loyal to any particular funders. So that's nice to be working with that kind of freedom.
Yes,
And I'm going to dovetail on that and just add that, a lot of us are proponents of the Insight Women of Color Collective came out with a book several years ago that the title of which is The Revolution Will Not Be Funded. And just really believing that this kind of work, which is really just directly opposing misinformation by the state public health information, the state public health institution in the heart of empire. If we're going to do that work seriously, it's not going to be paid work. And if it were being paid work, then we probably wouldn't be able to do it with a high level of ethics and efficacy.
Excellent. Thank you for that. And if someone could put the Insight book in there, it's brilliant the way that's been framed. And also, although children are in the vanguard, there is no child labor in the People's CDC. There is social reproduction, but no child labor. So there are leadership. Okay, next question. Thank you so much.
All right, next question comes from an anonymous attendee. They were wondering what drives priority as far as projects and how are decisions made?
Well, you got all the team leaders here. Who wants to take a stab at that?
I can just start off by saying that there is a coordinating committee that meets every couple of weeks, but it doesn't so much, define what all the organizations or the different teams do so much as just coordinate things across teams and prepare this webinar, for instance. So there is some infrastructure largely based out of the University of Orange. So that there's that infrastructure for Oz is indeed doing a major part of that, but also Molly and Mindy and Edgar. And at the same time, much of the heavy lifting, as we saw in terms of all the teams, is done at the level of the teams. They have some of them meet by Slack channels, some of them meet by Discord, some of them meet on Zoom. It's a very free-flowing kind of getting together stuff. If there's interest in putting together a long COVID team, there's a kind of collection of people to get together. We meet up on every Thursday at this time for our regular meetings, in which the teams have times to go out to breakout groups and then come back and report to the rest of the group about what work they've been doing. Some teams have been around from the beginning. Some teams have kind of whittled away. Some teams are in planning stages. And people, as Edgar brought up, we do operate under a model of the trolley models that if you can join us for a couple of weeks and work, that's fantastic. If life comes in the way and you have some things to do, you can step away for a bit and just get back on the trolley when you can. And so, that's where much of the heavy lifting's done in terms of the work that was presented today in the teams. And you make your choice as an individual participant in what teams you want to work with. And sometimes you might be recruited to a team because of something you understand about things. If you're, say, a nurse or an epidemiologist and your expertise would be helpful, a team might reach out to you and ask for you to join and participate. But it's a lot more free-flowing in terms of how this operates from week to week. So that's my interpretation of it. I'm curious if someone else has a different idea about how this works. This is a very much a free-flowing work in progress, and it's not so hierarchical at all.
Thank you for that, Rob. And I think Elaine, there you go. Elaine.
Hi, thanks, Edgar, Rob, everyone. I just kind of want to reflect on some of the questions and responses about our organization and how it was formed, because I think it's really a strength of ours that we come together out of our collective rage around COVID and how it's been handled. And many of the challenges that have been pointed out around the public health system and the lack of infrastructure and inequitable systems that have been created. But one of the things that I really love about this organization is we've had so many people from the public health field come into this organization who say, I don't want that to be that way in my profession. And I have values that I can really express quite freely here. And so you see that reflected a lot in the products that we put out. And, you know, I think that one of our strengths is to show that we can have a different way to approach public health, and we can work with people to do that quite openly, quite equitably, and we can continue to build better. And so that's one of the things I think we're really doing here. And one of the messages that I think that we really want to keep pushing in general out to the masses is, you know, help us build that and build it better. So I just wanted to kind of reflect on that. Thank you.
Yeah, thank you for that, Elaine. And we're looking for people's public health, and you know, public health workers are screwed. That's the politicians that are making the decisions. And we know that that's the case. And we have comrades that are within the CDC who are saying to us, go ahead with your bad selves, right? So it's an inside outside strategy always. It's a dialectical strategy. But we're outside as people CDC, we're creating our own grassroots thing. And I think that that's important, that people create this. And, you know, people have said, like, what is this? Is this a protest? Is this dual power? We're still figuring that out, you know, and one thing I do know, looking at the news recently, is the truth of the matter is that the labor movement is coming alive, and all kinds of movements are coming alive. So we should keep on thinking about that. Now, it is 27 minutes after the hour. And it is now time for some music and from some goodbyes. I would like the comrades to open up their mics and say goodbye to everybody, even if it's a little chaotic. And Molly.
Yay, chaos.
Bye, everyone.
Bye.
Okay.
Creative chaos is good.
Creative chaos is good. Very good. And also the babies. I want to hear the children. I want to hear those children because they're, hey, there you go. There you go. All right.
Quiet over here.
It's cool. Do you see? Ask them. Bye-bye. Bye-bye. Adios. Adios. Bye. All right, let's do some music here, comrades, if we can get it together. If this old Rican from the 70s can get it together. I think he can. There we go. I'm going to share the sound and the video because we are, of course, we are in East LA. I want to play something from Las Cafeteras. And here we go, comrades.
Notice or hear it. There's a line in there. It said todo para todos y nada para nosotros, which means everything for everyone and nothing for ourselves. That's an indigenous philosophy from the Zapatistas, a group of indigenous folks organizing for their dignity in Southeast Mexico. We're very much inspired by their movement. And I think Woody Guthrie was saying the same thing. I think a lot of us are saying the same thing. When we say universal health care, that's what we're saying. When we say we want educational justice for everybody, that means kids on the west side have the same quality of education over here. That's what we want, y'all. So this song right here is not really a song. It's a declaration. So I need y'all to clap right here. Your history books got it all wrong, so I come to you with this song. En 1810, con el gran grito de pasión, se levantaron con razón. Black and brown fighting together on a day I'll always remember. Cause my people, we never surrender. En el 5 de mayo, con el grito de gallo, black, white, and brown, bleeding together on a day I'll always remember. Cause my people, we never surrender. En 1910, it was Pancho Villa and Zapata fighting for tierra, libertad y techo, with other leaders on the front line, with bullets across their pecho. 1948, it was the Mendes family that first fought against segregation in schools. Because before that, they treated us like fools. Which decided to gangs, wars, and drugs. Get pissed off when we become Crips and Bloods, Pachucos, Traviesos, Hipoperas, Folkloristas, Haraneras in the street, Haraneras with a fireman's beat. Talking about what's really going in my Saturday street. Let's see, in the 60s, in Oakland, California, the Black Panthers organized for answers. In New York, the Young Lords were fighting against the wars aimed at with native rights. No shame in their game. Stonewall Rebellion remained true for the rights of the LGBTQ. In the campus of California, it was Filipinos who first laid down the boycott, screaming in solidarity, East Side, West Side, one rise, one fall. You come for one, you come for all. But see, today, Arizona and Alabama, they don't play. Carving out racist laws like they made out of clay. I stand with Emmett, Trayvon, Oscar, and Bell, with Eric Garner, Michael Brown, and got my people in jail. I stand with Mobile, head up in the cell. I stand with Mobile, head up in the cell. My ability to breathe is directly connected to my ability to see. It's not about me, never was, never will be. It's about we, y'all. Because today, East LA and South LA, we be one. Maybe not yesterday, maybe not tomorrow, but right now, we be one.
All right. A little love from East LA. Take care of yourselves, comrades.